Welcome to today's call entitled The Gut-Bone Axis and Osteoporosis. Is bone loss an autoimmune issue? And I think this will be a very interesting call for many people out there because I've spoken with many women over my career that are frustrated with either their osteopenia or osteoporosis and the lack of results that they receive from calcium and magnesium supplementation. And I've often wondered, is there an autoimmune component to these bone losing diseases? And it turns out that there's multiple studies suggesting this. And I'll start by saying the predominance of the research right now is in animals, and there's a couple of human studies so far, and that's growing. So as time goes, we'll know more about this, and especially more about this specific to humans. But the animal studies and the physiology involved is very similar. So I think this is worth talking about right now, and we can take action and hopefully prevent the bone loss and prevent the diagnosis in ourselves and in others by using this information. So I wanted to just mention quickly that I've written an Amazon best-selling book called The Autoimmune Answer, and that book is on autoimmune disease. Autoimmune disease is what I work with all day, every day. And although there's over 100 autoimmune diseases, the underlying mechanism or the underlying theme in autoimmunity is immune dysfunction. So the many autoimmune diseases are named based on the organ that is being damaged, but the underlying dysfunction or the underlying physiology is similar oftentimes. So if we can affect the immune system, we can get results with a wide variety of autoimmune diseases, ranging from Crohn's to Hashimoto's to multiple sclerosis to relapsing polychondritis to, the most obscure ones. So if we can understand that it's primarily an immune system disorder, then we know where we should start and what actions we can take. And so in my book, I walk you through 10 chapters with 15 different cases from my office on various diseases to help you explain that. I bring this up because if this is interesting to you today, then check out the book to learn more about other autoimmune diseases like Parkinson's disease, psoriasis, Crohn's, etc. But from my book, we're going to draw this image out of the introduction of my book today. And this probably looks crazy to the average viewer without immunology experience, but I think you'll understand this more as we go through today's video. So we'll perhaps return to this later and you'll look at it in a different light. Right now, it just looks like a bunch of circles with meaningless letters and numbers. Later, hopefully, it'll mean more to you. And the reason it'll mean more to you is because I want to teach you a little bit of immunology so that you understand the research that is connecting the gut and bone loss and autoimmunity altogether. So let's start that journey by jumping over to the whiteboard. All right, so here we are at the whiteboard, and now we can start drawing out the underlying physiology of osteoporosis and help you understand how the gut is involved, how it's an autoimmune mechanism. And when we understand those things, we then are empowered with actions we can take to slow it or stop it or reverse it. So let's start with bone first. First, we have to understand bone. So let's draw a long bone here. Let's say it's your femur, because if you've ever had a DEXA scan, that's the test they do to look at bone density. Okay, so this would be a person's left femur. And bone is built by our cells, okay? And there's different cells. The bone building cells are called osteo for bone. So osteoblasts. So I'll just put B for blasts. And you want to just know B because you could think B for building. So osteoblasts build bone. They're laying down bone to make bones stronger. The opposite would be osteoclasts, and osteoclasts are a specialized form of macrophage. Okay, so C would be classed. So in our immune system, we have cells called macrophages, and macrophage is Latin for big eater. Okay, so macrophage is the general term for cells that eat things, and each tissue has, or many tissues have, a tissue specific name for their macrophages. So in bone, the macrophages are the osteoclasts, and clasts are the eater. So you could think of the C as like an open mouth getting ready to go eat that bone, right? So we'll give it some teeth. So if we have osteoclasts taking a chunk out of the bone, we're losing bone density, we're losing bone strength, and that can lead to osteopenia, osteoporosis, fractures. Okay, so it's important to understand that osteoclasts are macrophages, and macrophages are actually cells of the immune system. So your bone density is highly interrelated with your immune function and with your level of inflammation. And we'll talk about this more as we go, but conventional medicine addresses osteoporosis as if it's a calcium issue, but postmenopausally, we'll learn more about it today, but postmenopausally, bone loss is less about calcium and more about inflammation and immune dysfunction, and that's where we're headed today. So let's dive into the immune system. We spoke already about macrophages and osteoclasts being the bone version of macrophages. Well, macrophages are part of the innate immune system, and so the innate immune system, think of innate starts with I. Innate is something inborn. Innate immune cells are, you could think of as the first responders. Okay, they are the local police. They are the firemen. They are immune cells that are innate or they're resident in all your tissues. They're waiting for a wound or for an infection, and they're going to start the fight right away. Then the other side of the immune system is called the adaptive immune system, and that's the secondary response, and that's the more highly trained immune system. So I think of them as the SWAT team, okay? And the SWAT team is made up of B cells, which make antibodies, and T cells, which are our primary assassins, okay? And so if we think about the adaptive immune response, in that image that I showed you a couple minutes ago from my book, I'm showing you how our adaptive immune system goes from a naive T cell, which is an immature baby, say, and grows up and matures into a mature T cell to become, say, become a doctor or a carpenter or a lawyer or a cook or something like that. Okay, what we know today is that there's 7 different types of T cells in our physiology, and they're denoted as TH or T helper cells. Okay, so TH, and then they're given a number. It could be 1 or 2 or 9 or 17 or whatever. Okay, so if we think about it, the way I visualize all the 7 different T cell subsets function in our immune system is as a tilt-a-whirl. If you've ever gone to a carnival, you've probably ridden a tilt-a-whirl, and you get in this little car, and the tilt-a-whirl spins around, and your car is at the edge of the diameter of the circle, spinning even faster. That's too hard to draw, so we'll keep it simple and make it a seesaw instead. Okay, and so on this side of the seesaw, we will put the Th1 cells. Okay, and Th1 cells are our main antiviral cells. They are anti-cancer cells, and they're surveilling for intracellular issues. Okay, and these cells produce a cytokine or an immune chemical called interferon gamma. And interferons are highly antiviral. They start that antiviral immune response. So these are beneficial to us. Well, interferon gamma is important for bone too, as we'll see. On the other side here, we'll put Th17 cells. So before we go there, okay, Th1 cells are the main antiviral cells. So if you have a viral infection, if you have an infection inside a cell, say you have a flu infection, well, then your immune system will recognize that your cell has flu inside it, and you'll have an antibody come mark that cell for destruction, and a Th1 cell will come and eat that infected cell. So you lose the self cell, but you also cleared the virus, so it was worth it. Okay, that's for infections that happen inside your cells. Well, say you have infection outside your cells. Okay, if the infection's outside your cell, it's too big to eat. That might be something like a parasite or bacteria or mold or yeast, candida, something like that. Okay, these things are big and they happen often in areas where you have mucus or hollow spaces, somewhere like the gut, the lungs, the sinus, the bladder, the urinary tract. Okay, and so if you've got an infection like this, the Th1 cells are not useful. Those infections are too big to eat. So then we need to recruit a different response. And at hollow spaces, we recruit Th17 cells. And Th17 cells, instead of eating the infection, it can't because the infection is too big. So Th17 cells will create inflammation against these infections. So they'll release things like interleukin 6 and tgf-beta and interleukin 17 and interleukin 23. I won't write them all down for you. But this becomes important because this becomes important to our bone conversation in a minute. But before we get there, I want you to understand that neither of these are good or bad. We've got both these Th1, these Th17, and remember five other kinds floating around at all times. And whether they're good or bad depends on whether they're responding appropriately or not to what's going on in physiology, right? So for this example, if you have a parasitic infection, it would be appropriate for the Th17 cells to increase because we want them to go clear that parasite, right? And then once that parasite is clear, we want the Th17 cells to return to normal. We don't want them to stay high, right? If they stay high, then that leads to issues. How? Well, let's see. If you say you have a parasite infection and your Th17 cells go up, that's appropriate. But what if the increase in Th17 cells is not enough to clear the parasite? So now you're chronically inflamed and chronically infected. All right. Well, that's going to lead to chronic inflammation and self-tissue damage, and that can lead to autoimmune disease. And Th17 cells happen to be the cells that drive the tissue damage seen in autoimmune disease. So we don't want these cells inappropriately high, especially chronically. Okay. So this Th1, Th17 balance is important because research has found that Th17 cells increase osteoclast activity. Okay, they increase what's called osteoclastogenesis, or basically they increase production of osteoclasts. So the more Th17 cells we have, the higher we are over here, the more osteoclasts we have. Well, think about it. With this seesaw scenario, okay, if you are Th17 and you go up on the seesaw, where did your partner on the other end of the seesaw go? Down, right? Right, because only one end can go up at a time. So if we've got high Th17, we're also inhibiting our interferon gamma, we're inhibiting our Th1. Well, Th1, I drew it on purpose in blue because Th1 interferon gamma promotes osteoblasts, promotes bone building. So if we have high Th17, we're driving osteoclasts, increasing bone eating, bone breakdown, and we're blocking bone building. So this is an autoimmune mechanism of bone loss. But we can take it further. okay? Because the research shows, and we need to remember, and I mentioned this in my book, that up to 80% of the immune system is in the gut, okay? So if your gut and your microbiome is a mess, then your immune system is going to be a mess. And so if we've got gut dysbiosis, okay, dysbiosis is a fancy term for imbalance in good bugs, which is your probiotics, versus bad bugs or potentially bad bugs. Okay, what might cause dysbiosis? Well, antibiotics are a common cause of dysbiosis. Okay, glyphosate is a common and ubiquitous cause of dysbiosis. A poor diet drives dysbiosis. Okay, if you have if you use steroids, those corticosteroids will drive dysbiosis. Well, I can't write that steroids very well, can I? All right. High stress and chronic stress drives dysbiosis. Sleep deprivation, and on and on and on. There's many things that disturb your gut flora, okay? And let's remember that it doesn't have to be gut only, okay? Th17 cells function in the liver, or excuse me, in the gut, the lungs, the sinus, the bladder. So you might have no gut issues, but have a sinus issue and be driving Th17. That still can drive the bone issue, okay? So the barrier systems, whether it's gut, lung, sinus, bladder, all become important in this conversation. So if we have gut dysbiosis, that leads to an increase in Th17 cells. Okay, and something we've talked about in previous videos called TNF-alpha, which is a very pro-inflammatory immune marker. Okay, and so an increase in Th17 cells and Th17 cells that are TNF-alpha positive drives an increase in osteoclast activity and osteoclasts traveling to bone and bone breakdown. That's one thing. There's research out there that shows that mice, when they have their ovaries taken out, so they've induced surgical menopause. Okay, so menopause, surgically induced menopause in mice leads to decreased estrogen, just like normal menopause does. Okay, so when you have a decrease in estrogen, that leads to an increase in Th17 cells, which leads to an increase in osteoclast production and an increase in bone breakdown. Okay, and so we see this connection of immune imbalance, gut imbalance, menopause or decreased estrogen for whatever reason, leading to increased osteoclastic activity. And when we have an increase in osteoclasts, that blocks osteoblasts. So we can have an increase in bone breakdown and a decrease in bone building, and that's a way to accelerate bone loss and speed our way to osteoporosis and fractures. So this is the mechanism, this is the autoimmune mechanism laid out in the research right now that's showing that osteoporosis, osteopenia, and even rheumatoid arthritis and osteoarthritis are tied to this gut-bone axis. So there's the drawing for you. Let's see what the research says. Okay, so here we are looking at the research from May 2022. So this is very new. This is in Frontiers in Microbiology, entitled Gut Microbiota and Bone Diseases, a Growing Partnership. And if we go down, there's multiple nice images in this study, but if we just jump to the osteoporosis focused part of the study, it says, bone is an essential organ of the human body, which relies on the dynamic balance between osteoblasts and osteoclasts to maintain its normal function. And imbalance between osteoblasts and clasts may lead to bone diseases. Osteoporosis is the most prevalent metabolic bone disease affecting society, and it's a deterioration of the bone microarchitecture. Okay, and this can happen in any age, but it's most common, in postmenopausal women, as you see down here. Okay, and so one connection is declining estrogen levels stimulate excessive osteoclast formation and bone resorption, driving rapid bone loss. Well, one driver of declining estrogen levels is gut microbiota dysbiosis, because your good bugs, your probiotics, they produce beta-glucuronidase, which is an enzyme that helps regulate estrogen. So if we have dysbiosis, we have poor microbiome regulation of estrogen levels, and losing estrogen leads to bone breakdown. Here they talk about when they take the ovaries out of mice to induce the menopause, they have increase in the TNF-alpha and Th17 cells, which breaks down bone. But interestingly, they also looked at, well, what if we give probiotics? Okay, so when they give probiotic treatment based on different species, mainly lactobacillus, prevents the bone loss induced by taking out the ovaries. And so they go through multiple studies and say, lactobacillus paracasei and plantarum enhance bone volume, tissue volume, trabecular number, trabecular thickness, and bone loss by reducing expression of TNF-alpha and IL-1 beta, which drive the osteoclasts. Bifidobacterium longum is another probiotic that increases bone mass density in rats who have had their ovaries taken out. Lactobacillus reuteri is an effective treatment for trabecular bone loss in mice with osteoporosis due to corticosteroid-induced or post-antibiotic-induced intestinal dysbiosis and barrier dysfunction, or leaky gut would be another thing to say there. So these studies looked at, okay, do probiotics have an impact on osteoporosis and on bone loss? And in mice, they do. So if these mechanisms are present in human bone loss as well, then we may benefit and preserve our bone by keeping our probiotic levels high and preventing that dysbiosis. And then we also could think about, hey, we probably want to be judicious about how many steroids we take and how many antibiotics we take, especially if we're worried about bone loss in this case. Sex steroid depletion increases the production of pro-inflammatory and pro-osteoclast cytokines, resulting in osteoporosis. Moreover, sex steroid deficiency increases inflammation in the gut by increasing intestinal permeability, or leaky gut, allowing to the entrance of bacteria into the bloodstream and increasing the number of bacterial antigens at the gut barrier. And then a bunch of this is more for me than for you. But then we'll go here real quick. Insulin-like growth factor 1 is an important hormone for regulation, for skeletal development and growth. And so having good probiotic levels means that your probiotics are producing short-chain fatty acids from the fibers you eat, and giving short-chain fatty acids to antibiotic-treated mice who lost their IGF-1 levels because of the antibiotics. If you give them short-chain fatty acids, which are produced by probiotics fermenting the fibers in your diet, that restores their IGF levels to pre-antibiotic levels. Okay, so if we're humans and we have gut dysbiosis because of antibiotics, one potential negative of that is that our IGF-1 levels go down, and we need IGF level for skeletal development and for bone health. So making sure, again, we reestablish our probiotic species, and we're feeding them with prebiotics in the form of broad and diverse fibers, then they can ferment those, or they can metabolize those fibers and make short-chain fatty acids, which help restore IGF-1 levels and bone health. And then lastly, here's a study in humans, and it says intervention with Lactobacillus casei shirota in elderly men and women improved distal radius fracture healing. And another study showed that in healthy postmenopausal Japanese women, the total hip bone mineral density was increased in the group treated by the probiotic Bacillus subtilis C3102 over 6 months. So here's at least 2 human studies showing 2 different probiotic strains as being useful in healing leg fracture and in preserving bone mineral density. So this is awesome research to see. We're early in regards to the research with osteoporosis, but you know, the mechanisms are highly plausible, and these mechanisms are involved in many other autoimmune diseases and well established there in humans. So it's likely that this is going to be determined true with future research. So what can we do? Like, how can we take this and make practical application out of this? Let's jump back to the whiteboard. All right, so here we are back at the whiteboard. The first and most obvious thing we can do is address the dysbiosis and or prevent the dysbiosis, right? Live in a way where we're not driving destruction of our microbiome and destruction of our gut barrier systems. So how would we do that? We want to get rid of all these arrows, right? Avoid antibiotics, avoid inappropriate use of antibiotics. You know, as best we can, avoid glyphosate. It is everywhere, so you can't 100% avoid it, but avoid it as best you can, and then work to, you know, be as healthy as possible in and around it. Avoid steroid use unnecessarily. Use strategies to modulate our stress. Okay, in other videos I've talked about stress as a tiger. So first we have to identify our tigers and eliminate the ones we can eliminate. The tigers we can't eliminate, we want to tame. And in so doing, we'll preserve our gut health and our mucosal barrier health. Stress has been shown to decrease the first line of defense at our mucosal barriers, called secretory IgA. So for chronically stressed, we're driving down our first line of defense and making our barriers more leaky, which can lead to dysbiosis and this whole cascade here. Diet, of course, diet's very important. A poor diet doesn't contain the nutrients we need for a healthy gut, healthy immune system, healthy bones, healthy life. And if we have a diet that's high in processed foods and sugars and, you know, animals fed antibiotics and glyphosate, then we're driving this process further. So those are lifestyle, you know, and then sleep and movement and all those things are important. And then probiotics is another obvious one, right? We saw multiple studies here where there's various probiotics that have been shown to preserve bone health, bone density, decrease inflammation, etc. How about immune-wise? Directly, can we impact the immune phenotype here? Yes, we can. If we can promote Th1, then we can flip this reciprocal inhibition, and instead of the Th17 blocking Th1, Th1 can block the Th17, and then we're not driving the osteoclastic formation, and we will be driving the osteoblasts. So you can drive Th1 with nutrients such as glutathione and N-acetylcysteine and berberine and bicalin, and there's many of them. Another way to address this, if we want to decrease Th17, would be, again, to not have dysbiosis, not in the gut, not in the sinuses, not in the lungs or the bladder or the genitourinary tract. So cleaning up any persistent UTIs or sinusitis or upper respiratory infections along with the gut infections. Optimizing our hormones, okay? If you're postmenopausal, working with someone to optimize hormone levels and optimize physiology that feeds into hormone. So if there's hormone issues, I want to look at what your blood sugar look like, okay, and specifically your insulin sensitivity, okay? How's your liver look? Because your liver has to metabolize those hormones. How's your gut look, which we talked about? And then inflammatory status. How inflamed are you? Okay, because inflammation chronically is a tiger, and a tiger is stress. And if you're stressed, you're in survival mode. So sending energy to sex hormones is when you're in survival, that's a waste. So the body's going to not do that because why is it going to give you materials for reproduction when a tiger's chasing you? That won't lead to survival, right? So if those peripheral upstream things look good, then you may need some hormone replacement to help prevent bone loss. And that's a whole nother conversation. And then you can block TNF alpha and block interleukin 6 and TGF beta. And there's ways to do that. Well-known ways that most people have heard of before are things like curcumin and resveratrol and fish oil. Those are great strategies. And then lastly, there are herbs that have been shown to promote bone health. One is called icarin, and icarin promotes osteoblasts and inhibits osteoclasts. So that comes from the herb epimedium. And then there's an herb called red sage, which is also known to prevent osteoclast formation and activate osteoblast formation. So these are all strategies that can be implemented with your provider and with someone who understands your entire case. They can understand which of these pieces is involved in your case and then help you address it in the clinically appropriate way. So I hope this came across as digestible and understandable, and I hope you see that it's much more than just lacking calcium. And if you're postmenopausal, it's probably not the calcium issue at all. It's more immune, inflammatory, gut, and estrogen based.